All right, it's 4 o'clock on a Tuesday, and today we're here to get our update on COVID-19, which continues to surge in the Commonwealth. Much of our history in this country has been defined by times of struggle. Even the formation of this great nation took a violent struggle, the Revolutionary War. Since then, every few generations have been called upon and have been truly tested to protect our national security, to fight for the lives of our citizens, and to protect the very soul of this country. Wars like the War of 1812, the Civil War, World War I, World War II, those are all examples. But so are the civil rights movement, stopping McCarthyism, 9/11, and so many more. We are in one of those struggles, and we are in one of those times. COVID-19 is attacking us, and we are at war with this virus. It threatens our lives, our livelihoods, and our very way of life. In the midst of this great challenge, it's time to stop the silliness and the games, to put aside personal ambitions or grievances. It's time to live up to our morals and to our faith. It's time to understand the time that we are living in. We either come together or we fall apart. Team Kentucky isn't a slogan, it's what it takes to win. It means we sacrifice, we look out for one another, we stay 6 feet apart, and yes, we wear a mask. Every single one of us. Today, we're going to report the second highest number of cases we've ever had in Kentucky. It should tell you that this virus isn't playing, and neither are we. And it puts so many at risk when we all or any of us fail to do our part. One individual that it puts at risk that wanted to be here today to make sure you understand the importance of wearing a mask is my friend, David Turner, Jr. I've received dozens of masks during this pandemic, but the most special one that I've received from anybody came from David. I've worn it repeatedly and used it to talk about the reason that we wear masks. The fact that we wear these probably means more time for David and his family, and as a father, I can't think of anything more important in this entire world. David Turner Jr., you're one of my heroes. He's an amazing kid. He loves Cub Scouts and Pokemon. I thought it was Legos before, but you got a couple here today too, so you love all things Pokemon, right? He's a 4th grader at Tully Elementary, enjoys the FCA and art club there. Yeah. First Lady and I met him and his parents, Elizabeth and David Sr., earlier this year, where David Jr. declared the day he visited not Kentucky, but National Ice Cream Day. I still remember that. I wear a mask for my kids, but I wear a mask for other kids too, including David. So today we've got David Jr., David Sr., and Elizabeth that want to talk about how important it is for us to wear masks.
My name is David Anthony Turner Jr. You should wear a mask to protect people, and if you don't wear a mask to protect other people, like people that are wearing masks, you are being unfair. You should wear a mask when you're with other people besides your family. You don't wear a mask when you're 6 feet apart or with your family and at home. I wear a mask to protect other people, and so should you. Thank you.
Thank you.
Anything else?
So David Sr. and Elizabeth reached out to us apparently one day driving. David Jr. started talking about the importance of wearing masks, and they volunteered. I think they called us. about coming here and helping us today. So if you don't want to wear a mask for me, that's fine. But surely you'll wear one for so many children around this Commonwealth who are counting on you and who need you to do it. So it's time. Every leader, every individual, every member of the executive, legislative, and judicial branch, it's time to wear a mask. Everybody that people look up to, including the president, who is now thankfully wearing one, it is time to wear a mask. We've had the Surgeon General say we can turn around a crushing rise of these cases if you wear a mask. We've had every major medical expert on any of the cable news networks say that we've got a shot at keeping our economy open if you wear a mask. And they'll all say the opposite, that if you don't, if you're too proud, if whatever the reason is, that our economy will not stay open, we will lose lives, and it's very doubtful that we will be able to get kids back into school. And today we have some new case studies out about how powerful wearing a mask can be to protect our small businesses, about how even if some of our individuals in those small businesses are positive, that wearing a mask can protect their clients. So I'm going to ask Dr. Stack to come up and to tell us a little bit about that, and I'm going to switch into David's mask for a minute.
Thank you, Governor, and thank you, David, for being here today. I like this. The CDC is our federal agency, the Center for Disease Control, that we rely on for a lot of the scientific data that we talk to you about. So this is the federal government now, and they release a lot of good information. And today, at July 14th, they had a new report that described, in the middle of May in Springfield, Missouri, a situation where there were two hairstylists who were working with clients, each of them for more than 1 week. Both of these stylists subsequently tested positive for COVID-19. Now, during that time, there's a few key points I want to highlight, and this is just reading this from here, that both of these stylists, stylist A and B, and the 139 clients that they took care of cutting their hair, followed the City of Springfield ordinance. Now, an ordinance in this case, they had rules. They had special orders, just like we do here in Kentucky, to require the public to wear masks when they couldn't socially distance more than 6 feet. All of these individuals, the two stylists and the 139 clients, followed the ordinance. After multiple weeks of follow-up, not a single one of those people who got their hair cut by those stylists had tested positive. So the CDC has made a graphic, and James has shown that up there. That's a lot of people, folks. All because they wore a cloth face covering, just like the ones we're asking you to here, and now the ones that are in the mask order that was published. And this is happening all over the country, whether it's happening at the city level or the state level. There are orders and requirements all over the country for people to wear masks because the evidence is growing day by day. It helps keep people safer. It allows people to return to work. It allows people to return to the activities we need to do for personal and economic reasons. So please, I'll keep trying to give you this information and share it as it becomes available, but this is really informative and really, really useful, because I think it supports very compellingly that the things we're asking you to do here in Kentucky are supported by the best current understanding of science and by a lot of other evidence that is accruing around the country. So thank you very much. Thanks.
So today's report shows that we are certainly in a time of escalating cases. And our actions over these next 10 days to 14 days, really through that 30-day that we have put this face covering requirement out, are going to determine whether we continue to be a leader, we continue to be one of the best states in the country, or we go the route of Arizona, which reports thousands of cases daily, and they are now requesting those giant freezer trucks because their morgues are being overrun. It's something I never want to have to do here in Kentucky, and it all depends on our willingness to come together and to do the right thing. But I think you'll see Today ought to be just one more wake-up call that we got to do it now. So today we're reporting 576 new cases of COVID-19. Aside from a day where we tested an entire prison, this would be the highest, and even significantly more than we had ever reported. If 400 made you gulp, 576 ought to create a knot in your stomach, because what we face is very, very real. What we do now is going to determine whether we can push that back down or whether we will suffer more cases and more deaths. And don't let anybody fool you. The more cases we have, the more death follows. Even if we do better than we did in the past, even if we have better care than we do in the past, more cases result in more loss of life. So with today's 576 cases, we are now 20,223 official cases of COVID-19. We have now performed 494,343 tests. I think that's up 13,000 from yesterday. It does show that we have a lot of tests that came in today. Positivity rate 3.95% based on the number of tests that came in. That's down a little bit, but we'll see it come back up when we won't have 13,000 more cases tomorrow. We're seeing people who are more concerned than they have been in the last month. We had 1,398 calls to the COVID hotline. That's more than we've had in a long time. When we look at some of the numbers that we are tracking, our new dashboard, we now have 86 of the 99 hospitals. I think we'd said 113 the other day. There are 99 that would be considered as groups that would treat COVID-19. We've removed behavioral health groups and others from that. So this is with a lot of the data, but it's not all of the data. So understand if we have more tomorrow or you see an uptick, it's because we still have 13 facilities we need to get information in. So what we have right now, it looks like we have 243 people currently hospitalized. Now we know that number will be a little higher from COVID-19 when the others come in. Currently statewide, it looks like we have 3,200 hospital beds taken out of about 5,000, so we still have a lot of room there. Currently in the ICU, we're reporting 90 individuals there because of COVID, and 564 total beds are taken up in the Commonwealth out of about 1,500. I don't have ventilators on here, but all of our numbers for ventilators have been thankfully low. So we're still at a point, even with rising numbers, that we have the capability to take care of people. But this can get overwhelmed really quickly. And think about 2-3 weeks ago when we're reporting 120 or 220 cases, and today we report 576. It means we act now, we act decisively, we make sure that we wear those masks everywhere, we stay 6 feet apart, no more excuses, we get it done to protect people. COVID cases by county, 74 in Jefferson, 66 in Warren, 29 in Fayette, 22 in Boone, 19 in Kenton, 18 in Graves, 17 in Madison, 12 in Christian, 12 in Hardin, 12 in Hopkins, 11 in Knox, 11 in Montgomery, 10 in Carter, and a whole bunch more that we'll post on our website. It's not only everywhere, but when you've got some of these counties that can have such high numbers in a single day, it shows you how quickly this can spread. Today we have 9 new kids under 5 years old that have tested positive for the virus. 1 in Fayette, 1 in Montgomery, 1 in Warren, 1 in Bullitt, 1 in Hardin, 1 in Scott, 1 in Campbell, Callaway, and Graves. Youngest today is 11 months. So remember, this impacts our children too. Sadly, today we're reporting 6 additional deaths, which brings our total loss of life to 635. I'm worried that's going to get worse before it gets better. With the number of cases we've had come in over a short period of time, if you look back at that same number of cases and extrapolated, you know It's about 2 weeks after when you see that impact. That means we got to be real careful. We have to protect one another and remember that there are so many out there that are vulnerable to COVID. Today's include a 72-year-old woman from Shelby, a 77-year-old man from Floyd, an 89-year-old woman from Casey, a 44-year-old woman from Carter County, 82-year-old man from Ohio, and another 60-plus-year-old, which we've been reporting a lot of lately, a 65-year-old man from Fayette County. Turn on those green lights for these people. Please. There are multiple counties here that have never had a loss, and they do now. And with thinking that there is going to be worse to come, now we can head off most of that, but some damage with this number of cases is going to have been done. Let's make sure that we amp up our compassion, our willingness to show people that we care about them, and make sure we're there for one another, because there's going to be a lot of people that need our help in the coming days. Long-term care facilities, we have 12 additional residents, 12 additional staff tested positive, 2 additional deaths, 3 new facilities. In child care facilities, I'm told I'm supposed to call them child care facilities. As much as I talk, I will not use the correct term every time. I'm happy to report there are actually 2 fewer staff that are positive after doing extra due diligence, but there are 3 more children. I don't think any of us would want to make that trade. This is something, again, with the number of kids under 5, and right now with class sizes up to 28, that I don't think any public health official thinks is safe. There's just some risk out there. I hope that the facility that you'd be taking your kids to is following the rules and restrictions to make sure they're as safe as they can be. A couple of other announcements today. The Kentucky Safer Hotline has been reactivated as we require masks and encourage social distancing and good hygiene to protect fellow Kentuckians. I want to remind people that they can still go to this phone number or kysafer.ky.gov to report concerns about the rules and regulations not being followed, about businesses serving large numbers of people unwilling to wear masks. It's fully staffed for people to call with their concerns, and it's at a time where we just need to ensure we have all of the positive pressures out there to stop this thing. I mean, I remember the Surgeon General, was it yesterday or the day before? I think it was yesterday that we played his video. And he said if we'd wear masks for 2 weeks and keep 6 feet apart, we could be beating this virus. Whew. Those seem like 2 things that we ought to be able to do. All right, announcing additional help today for our local governments that are working on the front lines to defeat this virus. Today we're highlighting the hard work of those governments. First, thank you. Thank you to everything you are doing and the help. I think I've only had a couple of local leaders ever turn down testing in their communities. Just about everybody has embraced it. The vast majority of our local leaders have stepped up, supported this mask mandate because they realize how quickly these things can escalate. You got Albie Brock in Bell County, somebody I've known for a while now, who has talked about how, again, it's not a statement. It's just about caring and protecting for one another. It's Judge Mike Buchanan. Both he and Albie Brock are of different parties than I am, who wholeheartedly endorse this because of what's happening in his county and his region. Those are 2 local leaders that are putting people's lives above politics, divisions, personal ambition, or silliness. We appreciate them. We got to continue to keep that up. So we set aside $300 million in CARES Act funding for our local governments. They do have to apply for it, but there's a specific allocation for them. They just need to show us the receipts, if you will, so that we can ensure when the federal government audits that we spent this money correctly, and the federal government is looking at it every day. Since last week, we've announced more than $4.9 million in reimbursements for Western and Northern Kentucky local governments. So today, I'm excited to announce the final approval for more than $16.5 million to 18 local governments in central Kentucky. The governments approved are Adair County, Anderson, Bullitt, Franklin, Harrison, Jessamine, Nelson, Nicholas, Scott, all counties, Audubon Park, Cynthiana, Georgetown, the Lexington-Fayette Urban County Government, Meadowvale, Prospect, Sadieville, Somerset, and Stanford. Funding is going to be used to help offset costs that have been incurred because of COVID-19. Since the application was released, 140 local governments have applied for reimbursement. We've approved 58, totaling more than $30 million. We're in the process of doing more. Listen, this is just us being able to support Team Kentucky out there. Keep it up. That hard work is really important. All right, our goal was to move fairly quickly today. I think we are now in a position to move into questions. We have a number of individuals here, and I have about 6 questions that have been submitted. So why don't we start with you, Tom Latek?
Yesterday, I went to the committee meeting in the annex with every lawmaker, every senator, every presenter, and a number of the media wore masks. Today, it appears that's not the case. What are your thoughts on that?
James, do we have a picture? So Tom Latek just asked me about today's hearings of the legislature. Yesterday, it appeared that people were going to wear masks. Yesterday evening, a state senator, and we're going to respect his privacy and not talk about the situation, but tested positive for COVID-19. He'd been in various hearings. But today, we had almost every member of one political party's representatives and senators not wearing masks, not being 6 feet apart, after having been potentially exposed, after having a mask mandate, with record numbers of cases out there. I'm not trying to publicly shame people, but we need leadership. And with even the president wearing one, this isn't right. And let me remind you that this is the group that wants me to discuss the mask requirement with them. It's time for leadership. I hope and expect to see everybody in the annex wearing one starting tomorrow. Otherwise, their employees, their very employees, are being put at risk for this lack of behavior. It also spreads contacts from, one's from Lexington, one's from Hazard, if I'm seeing the right folks up there, and they basically can take all those contacts from each other and take them back into their communities. It's almost like going on vacation somewhere where you shouldn't. And I didn't take this picture, they posted it themselves. This caucus posted it themselves. I mean, we're in a life and death battle, and you can't be doing that. Stephanie? Mm-hmm. So the question is there a scale back of testing capacity at various sites around Kentucky, with there being some longer lines and some fewer lanes? So a couple of weeks ago, we moved to summer hours of our 2 Kroger sites, and we weren't seeing them being fully booked. It showed some concerning signs in June that we were all watching, but we hadn't seen the escalation of cases in. Something happened right around the 4th of July, where pretty much the 5th of July, we had a lot more people that suddenly wanted testing when we'd been waiting for people and they hadn't been showing up. So we have, in fact, increased hours at all of the Kroger drive-through sites. I think it's an extra hour, an extra 100 plus individuals that can be seen. Now, some other sites are still trying to decide what their future is, that are run by other groups. Originally, the federal government was going to stop funding some of those groups that are out there, but appears to be changing their mind on that. But if you'll put up the testing locations, we need folks to use this resource on kycovid19.ky.gov. If there's a long line or you can't get one of our Kroger appointments, you can get an appointment. They are all over the Commonwealth, and we need people to get out there and to get those tests. We are looking at ways to increase our testing capacity. We have contracted for another several months with Gravity Labs to ensure that we have not only enough testing moving forward, and that supports both the drive-through and the hospital testing, but also that we get our results faster. So we are seeing a bigger demand for testing all over the country, and in many states. I talked to somebody today, he went to a place where they used a national lab. It took 14 days to get his test back. That just doesn't help at all. So yes, we are very much mindful on the testing front. Now, I do believe we have more flexibility, and we are in a better place. When we started, we didn't have any of these resources. But we've got some homegrown heroes in Gravity Labs and Solaris and Blue Water that give us a lot of options there. Visitation on nursing homes tomorrow. Given the recent spike in cases, has the guidance on that front changed? I believe that we are still moving ahead with that visitation, but there are a number of safeguards in effect. If we find that there are spread through it, then we'll have to look at it. We also have to continue to watch as the cases rise and what rate happens in the nursing homes. Now, the fact that we have tested everybody or just getting through in all of the most significant long-term care facilities gives us some comfort. Now we're moving to staff and making sure that we have some regular testing there, because that's now how it gets in. Joe.
Probably can't get into specifics on individual cases, but some of the younger people that are contracting COVID-19 over the past couple days, past week, are you able to say how they're contracting it? And secondly, generally, through contact tracing, have you been able to determine how most people are contracting it?
Let me try to get you some numbers on that. We are seeing, so we get sometimes more of anecdotal reports from how a cluster is created. That's what we typically get from local health departments. I think right now the number one leader on that is people going on vacation in places and going to beaches and coming back. Second, we've seen a number of cases at high school sports practices. Now, those aren't necessarily a cluster, though there was one in a high school weight room that we saw, and so places that some of these younger people are getting together. We have seen spreads in some houses of worship in certain parts of Kentucky. In others, we have seen almost none. I think it all depends on the level of cleanliness that people are using. But let me try to get some more information on that. Now, from yesterday, I owed you an update on Kentucky's prisons. We've got Michael Brown, who I should have asked to do this before we started questions. And then we'll continue.
Thank you, Governor. Let me start with sort of the big picture, the overview. Kentucky has 13 institutions that we run and operate and incarcerate individuals in. And as of today, our totals for the overall look, and then I'll get into some of the specifics. So far, we've had 624 positive tests system-wide, inmates who have tested positive, I should say. We've had 83 staff, and by adding one over the weekend, we have had 4 inmate deaths, and this is the system-wide numbers. As has been widely reported, the largest group had come from Green River, where we had over, at one point, 400 positive tests. We had like 51 staff and 367 inmates. And as I reported last week, we've had a recovery of all but one of those individuals. And that one, he tested positive, came back again and tested negative, but we're still listed in the positive thing. Now, the more recent developments, and I'll start with the largest group, come from the Kentucky Correctional Institution for Women, commonly referred to as Pee Wee Valley. Our first positive test came out of Pee Wee Valley in May 26th, and that was a medical staff member. Then, and this time sequence, Dr. Stack could probably explain, but it gets significant. About 2 weeks later, then we started having some inmates show symptoms. And then on June 11th, we came up with 11 positive inmate test. Fast forward a month later to the 12th, which is my most current numbers, we have 207 positive inmates and 19 staff. But I would point out that at this point, the entire institution has been tested and the entire inmate population has been retested. So if you remember going back to Green River, we got down and we tested that population, came back and retested, and then that plateaued. It's our hope that that happens at KCIW. One last thing there, we have 4 inmates that are hospitalized out of KCIW. Moving on to another of our institutions in that same Oldham County area, and I would point out that seems to be significant. Outside of Green River, none of our more rural institutions have reported any real issues. At the Kentucky State Reformatory, we had our first reported inmate positive test on July the 5th. So again, fast forward for an incubation period, and as of today, we now have 49 positive inmates, 6 positive staff, 3 are in the hospital. Green River, as I said, is reporting very well, and we have had no cases at the vast majority of our institutions, no staff deaths, and we have those 4. That most recent one came from the reformatory. It was an individual that had a lot of underlying health problems, and in fact thought at first it was a heart attack. He was tested and he tested positive. So in keeping with our transparency and how we've been reporting everything, in those situations, absent some other obvious cause, we report that as a COVID death. Thank you, Governor.
Stu? So the steps that were taken at Green River are the types of steps that we need to take in our other prisons. Sometimes it is easier given the setup. Sometimes it's a little more challenging. But the first thing is you need to know who's positive and who's not. And then you need to make sure that you can remove those that are not positive, right, from those that currently have the virus. That gives you the start of containment, and then you need to take steps for those that are more medically fragile to ensure that those are separated really from either group, and that's what we have done in those circumstances. My understanding is that's what we are doing now. It means we need to step up cleanliness. We need mask wearing at all times, and that's not just, we seem to just focus on those incarcerated. It's also everybody coming into the facility. It's everybody working in the facility. It's incredibly important that we take those steps right now, but we do have a model that I believe that if we can follow, we can stabilize the situation. Joe. Well, the very first person who tested positive at Pee Wee Valley was the medical staffer. But do we know the first case at the reformatory? All right, we're checking on that, and I'll come back if we do. Some of our listeners have contacted us saying their local health departments refuse to take complaints of businesses not following the mask ordinance. You can call the number we put up on the screen, the Kentucky Safer Hotline. Question about when evictions could take place in Kentucky again. I believe that there is a lawsuit in northern Kentucky that we're actually going to ask for mediation in that one. There are some important points that it brings up. We just want to make sure that the right procedures are in place to where there's not such a power dynamic that someone who can't pay their rent because of COVID is forced to enter into certain agreements. For those that can pay their rent, you need to be paying your rent. And if there's discussions that can be had there with landlords, I think that's reasonable to do. Tom?
Governor, regarding testing, I guess Kroger is free to the public. Are the other ones as well?
So the question is on testing. Kroger that we set up are free to the public. Are others as well? They're supposed to be, But it doesn't always work out quite that way because we've got insurance, we've got Medicaid, we've got many different types of payers out there. Every couple of weeks, we've worked to eliminate other barriers that have been there. I think Dr. Stack announced one just the other day to make sure that we could provide those at little or no cost. But for instance, Medicaid will pay for them. And if Medicaid pays for them or if private insurance pays for them, we don't want a copay going to the individual. And at this point in time, you shouldn't have to have a referral from a doctor just to get one. And that's one of the things we tried to stop. Because if you have to have a referral from a doctor, you're paying to go see the doctor before you get to go get the test. We have a complicated healthcare system. And so getting in and trying to eliminate all the different ways that you can be charged for a COVID test is difficult, but that's still our goal now. We do want for our insurers and for Medicaid and Medicare to be doing reimbursements because that helps create a better private supply chain of testing. And that's really important when we get through this to augment the public testing. You know, we sit and talk about, are we doing the right things with our public testing? If we do too much, is it preventing the private testing from doing what they need to do to get going? If we make it too easy for them, this is an epidemic. We're doing all of the testing on our side that we can, regardless of the ramifications of that. But the need to create that market in some form that would be in the regular course of healthcare is important. It just can't cost the individual anything. Oof. The question is some calls that they've received regarding, the WFPL has received regarding employers that won't pay people when they've tested positive and they're out and/or are requiring certain procedures if you want to go get tested, and what are we doing to make sure the right incentives are in place? I mean, it is incredibly short-sighted for a business not to offer paid leave to someone who has this virus, because otherwise somebody desperate isn't going to tell you, is going to go to work, is going to infect your workforce, and instead of paying one person for 14 days to make sure that you don't infect everybody else, you're going to lose your entire workforce. I mean, that's just not smart business. It also means that business that goes through that is not safe to the public, so I hope everybody by now is doing paid leave in those situations. We certainly pushed hard for it. I'm using this bully pulpit to talk about it as much as I can. I've heard, and I think it was about maybe a TV station, about the concept of having to get permission before getting tested. I don't think your employer can dictate your health care decisions. If you're worried and you want to get a test and your employer is trying to stop you, why don't you call us here in state government and we'll talk to them. Joe. So today, the committee that we showed earlier that wasn't wearing masks in a time where we have 560-something cases, took a vote to ask the Attorney General and the U.S. Attorney to explore or investigate the contract to remove the Jefferson Davis statue. It's silly. I didn't know the company's name or who they were until I showed up the day they were removing it. All of the testimony shows that what was done here follows each and every procedure. The individuals that voted for this didn't bat an eyelash on either the Brady deal or what the last governor paid his chief of technology buddy. It's just partisan politics at its worst. And there are so many conflicts of interest in it. I believe that the chairman of that committee, his son was the number 2 lawyer for Bevin and is now the number 2 lawyer for the Attorney General. And if that's accurate, that would have been like Steve Beshear asking me to investigate Matt Bevin after Matt Bevin said something about him. I mean, that's, and separately, there's still the ethics opinion in there about the AG's office and investigations of a governor's office. I mean, come on, folks. I mean, at a time when we've got such a challenge in front of us, I mean, this is just, it's ridiculous, and there's nothing there. I'm happy to talk to the U.S. Attorney when I don't even know the name of a company that's doing something or has a contract. Joe. I'll go to Stu first. We'll get you both. Stu. So we're going to get you a full report on unemployment claims that are remaining for each month, as well as the number that are being processed under the contract and in each of our locations this week. I hope that we have that on Thursday. We have an issue in the data that we have to correct, and that's that there are certain claims that based on changes from the federal government were denied under federal law initially that are now being allowed months later. And what that does is make it look like a claim from March hasn't been processed when the federal government made us reject it, and now we can consider it. So we're going to have to break those out to show you, how many of that group that we needed to get through, we've gotten through, how many new ones have come in that may have an older date, but are almost new claims for us to look at, and that we haven't had the ability to do it to date. And I want to start looking at and showing you the efficiencies of in-person. We're typically getting 1,000 people per day at these locations, and the good thing about it is we either get them fully resolved or the person gets a full explanation of why it hasn't been resolved either in their favor, and sometimes it's that they don't qualify at all, but at least you get an explanation of it. It's hard to read through a statute or a website and to get that. So I want to make sure that we not only get you that report, but it's accurate. And I will tell you, I'm frustrated in how hard it is to get accurate data on it. I've been frustrated for months on it, but we'll give you everything we've got, and we'll try to tell you where all the warts are in that data as well. All right, Joe.
In regards to the prison population, I know you issued a few orders commuting sentences of people to kind of reduce the population in light of COVID-19. In the last couple of months, have you thought about commuting any more sentences because of that, or have you thought about any other ways to try to reduce the prison population because of this issue?
The question is with, I guess, increasing cases or cases in new prisons, have we thought about another round of orders that would reduce the prison population? We don't have anything that we are considering right now, but we are watching as these cases spread. There are certainly more institutions now. And one thing we may do is go back and look if anybody has qualified since we filed those orders under the exact same reasons and the exact same process that we followed. So it was at a point in time where if you committed a nonviolent, non-sexual offense, you had a certain smaller amount of your sentence left. That's the group in the population that we considered. But that wasn't an order moving forward. So one thing we may be able to look at is who would now qualify, since it looks like we're having another spike under that same order. All right, today as we close this press conference, I'd like to take a moment to honor some of those that we have lost to this terrible virus. These are Kentuckians we've shared before whose families have given us permission to share their loved ones' stories. They include Dana Davis, the beloved nurse who's only 51 years old, and Marilyn Thompson, another frontline healthcare worker from Bowling Green. It includes Jerry Mays, a hardworking grandfather who is dearly missed by his grandchildren. And my friend Lillian Press, who impacted the lives of so many Kentuckians, including my own, and whose Governor Scholars Program has been able to move along even in a very different phase. I know she'd be proud of that. These are not just numbers. They're mothers, fathers, grandparents, and friends. And there are only a few individuals that COVID-19 has taken from us. In this moment, let's lift all of those we've lost, all of our loved ones, up in prayer, and let's recommit to doing what it takes, knowing that we could face more loss as we move into the future. These are special people, and I hope that the importance of preventing this loss is the most important thing to us. We've talked a whole lot the last couple weeks about the number of court cases or the number of hearings or the number of other things. It's the number of lives that counts. That's it. I mean, it's about protecting those around us. I think we can do it while still keeping our economy open. I think we can do it in a way that hopefully lets our kids get back to some semblance of school. But we need you to wear a mask. We need you to stay 6 feet apart. Do it for David Turner Jr., who shows us how critical every single day is, and do it for all these individuals whose families miss them. We'll be back, I think, Thursday at 4 p.m. We'll probably have a video out about tomorrow's results. Stay safe. Thanks.